Thank you for having me here. Being in the field of dentistry and being a specialist of oral surgery makes me a little bit like an exotic creature, because among all you biohackers, I'm an exotic guy. Anyway, my topic also is aesthetics and how to achieve it with minimal invasive techniques. You are all here to learn techniques about methods and a creature which can do everything. But to be honest with you, it doesn't exist. It doesn't exist. You have to get all the little bits of pieces and information during that meeting, in other meetings, to put together your own puzzle to get the whole picture and to create the right technique for your own practice. My name is Dr. Kilthau and I'm from Mannheim, Germany. Mannheim is about 45 minutes southwest of Frankfurt. And this is my team, former team. I'm 66 years old now, so I decided to shrink a little bit, not by size, by tallness, but also by my team. And down here on the left, you will see a big Baroque castle, which is even bigger than the castle of Versailles in near Paris. It has one window more. And believe it or not, Mannheim is the city of three inventions which changed the face of the world. Number one, the car was invented by Mr. Benz. Number two, the bicycle was invented by Mr. Dreiss. Number three, the bulldog was invented by Mr. Lanz, and is nowadays the company John Deere. And I was produced there as well. So I'll speak shortly about dental aspects, bloodless implants, porous veneers, ceramic restorations, bleaching, Invisalign, and I cover topics you already heard about just in the last lecture: Botox, fillers, lateral lasers, mesotherapy, and peeling. Why are cosmetic treatments so popular? Because they make us feel good. We all want to look good. That's the point. And we can help our patients to achieve that goal. So as a dentist and being a doctor as well, I try to give my patients a service beyond the molars. Not only fillings, but something else. And for biohacking, it's important to know that every tooth is connected to a certain organ. It's the so-called odontome. And Sabine left already. For her, most important is down here, the molar in the lower part of the jaw, which is connected to the microbiome and the intestine. And usually when a tooth is affected, I don't advise the patient for root canal treatment. I'd rather take the tooth out, especially when we have a CAP, a chronic epidural periodontitis, and replace this tooth directly with a zirconia implant. First, I extract blood, make the PRG, the plasma-rich in growth factors, PRGF, sorry, and then you add the PRGF plus the zirconia implant right into the socket where you have taken out the infected tooth. So even old root canal fillings don't work because the canal is not a closed area. It communicates with the body, and a lot of poisonous toxins are released into the body. And as you can see, every tooth has a certain connection to a certain organ. About smile design, I don't want to bore you. It's about facial, group, and gingival aesthetics, and also the tooth aesthetics. All these methods lead to one goal, which is the optimum in aesthetics. For example, facial and dental. For that reason, I created within my clinic office, which is called Belsanum. That means here we offer aesthetic treatments and wellness treatments, because this has to be separated in Germany, otherwise you have problems with the healthcare insurances. Well, certainly these theories are determined by your knowledge. You are here for that reason. By your experience you get over time. As a dentist, you should also have some talent to handle stuff when it's delicate, and you should know about the patient's history, what he wants. Here we have a little example. What you can do with the tongue. That's about noon. We talked about noon yesterday. 30 years later. So what can be done for such a lady? She can count now on dental implants because they fix the prosthesis down there on the bone. Dental implants are always the perfect solutions as alternative to bridges and dentures. They look and feel like natural teeth. They are highly retentive as a permanent solution, and they improve taste and more natural function. Because when you have an upper prosthesis, wine does not taste the same like you would have if you have natural teeth, besides when you drink wine. So reasons for tooth loss are several, as you can read yourself, and the solutions are different timings for implant placements, like immediate or later. The areas are all over the mouth. So you can replace single teeth, you can replace even existing bridges and replace the pontic, which is the gapping area with an implant. You can replace posterior teeth, several gaps, and the whole totally edentulous jaw. So, examples. We had here a trauma. The lady had lost the clinical crown. The solution was a dental implant out of titanium. We can see it on the right bottom side, and that's the outcome. Doesn't look that bad, right? Leadless implants are the reason why patients after the treatment don't experience inflammation, they don't have swelling, they don't have pain. And usually you can use the socket you create by extracting the tooth, or you punch with a biopsy punch the area where you want to place the implant, depending on the size, that means length and diameter. This I don't have to skip. The bone sets the tone, but the tissue is the issue. So tissue sometimes is thin, or it's a thick biotype. So you have to this depends on your technique. If you're punching or cutting the tissue and then revealing the bone. I rather prefer punching because this is less trauma, and this is truly minimal invasive. Also, the papilla correlation is important, where you create a contact point. So the papilla goes back within the 5 millimeter to 100%. If it's less or more, you have different outcomes. About tooth show. You have the incisal show, facial show, and cervical show. That's the gummy smile. Especially ladies have gummy smiles. Most of the men don't have. I don't know why. So advantages of this endoscopic punching technique is that the patient suffers no pain the next day. Usually has absolute no swelling. So no discomfort and no bruising, and the technique is very fast. Examples. So all the students lost their front tooth, and the solution is on the next page. Do you see a difference? So it's quite good, yeah? So it's before and after. Very important is that the implant has no micro movement. That's most of the time the case when you really install the implant in the good bone. So these are the options. Immediate delayed implantation usually plays no role in my office anymore. I usually do the immediate implanting technique, as I told you, taking out the tooth and replacing it with a ceramic implant, not titanium. Before the titanium age, there was nothing else, but now we have zirconia, and you can make a blood test, so to know if the patient has a not an allergy, but a hyperreaction to titanium particles, and then you know for sure also for the private insurance company that you can use the zirconia implant because it's a little bit more expensive than the titanium implant. 100 euros or so. So immediate implant relevant is fractus implantology. Important is that the bone width should be at least 6 millimeters or more. Here we have an old gentleman. At this time, I took the pictures, he was 94. He stumbled in the garage and he knocked out his front teeth. I replaced them with 3 titanium implants, and then he was a happy camper again. Other examples, and this is not the father of Martin Landenberger, I can tell you, although there's a little similarity. Some other guy who lost front teeth due to periodontitis, and the lady. So the aesthetic outcome from here down to here is much better. You can plan the implant placement by MRT and then make a template or let it be done by a lab, and then even my assistant can do the implantation because it's just following the steps, going down the template, easy. Here we have again in the posterior area 2 premolars. Here's the punching, then we see the implant and the radiography, and then you put an abutment on top and then lay down the crown. If there is not enough bone, you can help yourself by augmenting the sinus. You put in some graft material, synthetic or natural, or PRP or PFG, and then the bone is thick enough in the sinus level, sinus bottom, you can place the implant immediately. Or you wait till the whole graft consolidates, and then later on you may place the implant. This is an example for the template. 3 implants. The first drilling is always done with the template, which is easier. And this is DVT, a digital volume tomography, to organize yourself and orientate yourself much easier. Here we have modern handles combined with classical front preparation. Front teeth again, bigger face, combination of classical crowns with implant crowns again. Here another 4 implants in the forefront. And people who had intermediate prosthesis are very happy to have this kind of treatment because they have fixed teeth again, they can bite into an apple again, which is a valuable treat, to my opinion. So the type 1 is usually the one I usually do in my office right now. When you don't place implants, usually the bone degrades. You have atrophy. That means when you have decided to get a the prosthesis squeezes the tissue. When you squeeze your arm, for example, you will see a mark of pale skin. So the same happens with the tissue in the upper or the lower jaw. You chew down your food, you get less blood circulation, and over the time you get the atrophy, and you can see what the atrophy does to the bone. And the conclusion is to place the implant to keep the bone up the height you need it. Oh, again. So another solution for somebody who has already existing prosthesis and wants to have an implant treatment are locators. Locators are gimmicks you insert into the prosthesis and into the implant. For example, you can see here, there are little tabs. It's called the Matrizer, this is called the Matrizer, and you can provide to every patient who has existing prosthesis and is confident with them a better hold and a better fit to chew on good food, as we recommend to everybody, vegetables and salad. So this is the technique for the locator. And on the left one, on the right side, you see a transferable fixed screw, the locator, and a cemented crown. And this same hours. Also after 10 years, I don't have a lot of reclamations. So we come to dental treatments to repeat something of the topics you already heard. The lady had the problem with the front teeth, and additionally she wanted to get rid of some of the wrinkles in the forehead, the frown line. And I think to create a beautiful smile only by improving the teeth is only to put Mona Lisa in a plywood frame. So you should maybe think out of the box. And this is in the trend because Americans spend some money over the years on their beauty. And it's not only boobs and face, it's all kinds of treatments. I've been working in Dubai at Cosmosearch Clinic, and we had there so many treatments, buttocks lifted up, boobs lifted up, faces lifted up. I don't know what we lifted up. Mona Lisa after 1 week in the USA, or in Brazil, the same thing, no difference. You just heard it from our colleague, what the epidermis and the dermis and the subcutis do when we age. We have less water, we have dehydration, and then the increase of wrinkles. So our target is not to build a leg, but to fill and form the skin. How can we do that? We can do that with a lot of materials like fillers, with Botox, and I really think it's better first to administer Botox and then to do the filler because the active muscles, the filler is not in place and is getting resolved much faster. So it's better to first administer Botox and then to do the filler. And then we can go on by microdermabrasion. We can cover with plastic surgeon, which is around the area, and we can reduce fat in the lower part of the skin with lateralizers. Also, we can then relieve the clenching of some patients who are doctors like Homer. When you are thinking about your patient next day, when you clench in the night, ask your wife, what did she tell you? Do you sleep like a baby or you clench? So Botox or an appliance could be the help for you. Botox is also muscular hypertrophy, especially in Asians or Asians. And dentists, not being MD like me, can treat also patients because they can relax muscles in the muscular area. So it's not always an issue of being only a dentist or not a dentist. Now, how do I tell it to my patient? You can read it by yourself. I don't have to read it to you. A visual side effect will always be the smoothing of lines between the brows and in the forehead when treated in this area. That means when you have the clenching as an indication, no patient says no to the improvement of the forehead, the wrinkle around the orbiter. So these are 80 units of this sort from the company Ipsen. Today it's Esalia from Galvera, which has a lower dosage. Here are the marks for the orbiter and the glabella formalis, the Galea aponeurotica. Michelle, you know better than me, Galea aponeurotica. And there's a result after 2 days. So we have to stand again. And what you can do is you can influence the corrugator supercilii to get rid of the frown line in front. So you inject 3 points over to the next muscle group, and this does the job. Another example, even males are interested in this kind of treatment, not only females. This is frontalis. This is this muscle who is influenced by this kind of treatment. And we have the orbiter, especially for older persons, is a musculus orbicularis oculi, which then we inject over here 3 points, and this does the job usually. You can read it yourself. I don't have to read it to you. There are different trademarks on the market, like Botox from Aragon, Bisport from Ipsen, and Furamine from Merz. You know them probably, right? That's the mechanism how Botox works. I don't have to go into detail because I have to speed up. First, you have the vial with a lyophilisated pellet. You dilute it with some isotonic NaCl solution, and then you put it on ice, and then you inject it directly. After 8 hours, the effect of Botox diminishes, so be always aware to make it fresh. Okay? These are the rules. The marker, the syringes. First, you have to document really well the patient, his expectations. He has to sign a consent form. You have to explain him all the contraindications and side effects, and then you can go on with the treatment, not before. And you have to manage to get the right price. So these are the contraindications, you can read by yourself. And this is the methystoclor, by the way, which is a mistake. When you inject too much lateral, so the muscle here takes over the control and the side is paralyzed. Mephisto was the devil in David's slave house. Anyway, that's called Mephisto as well. So all these kind of muscle groups you can influence, and you can also do certainly the clenching of HOMA with appliances, with splints. You can do coronoplasty, that means you grind down certain parts of pre-contacts. You can make a removable overlay partial. You can aim for orthodontics to improve the alignment of the teeth. You can even go for orthodontic surgery, and you can have full mouth reconstruction to have the ideal occlusion that HOMA doesn't clench anymore, right? Okay, main indicators of Botox to relax the perfunctional muscle action. Now, the hypertrophy always comes very often in Asian women. I know, or people who like to chewing gum a lot. Then you put in 5 doses, and you see the result on the lower part before and after. That's a protocol for how to treat masseter hypertrophy. The dosing prevention is very brutal, I have to say, but you need it. So we have all the muscle groups, but don't be fooled. The muscle by itself is surrounded by a lot of other structures you have to take care of. Nerves, arteries, veins. So always be knowledgeable about your anatomy before you inject. The dosing for migraine is also very effective. If somebody aims for surgery to get rid of chronic migraine, you rather start with Botox to make a test drive if the relaxation of this muscle helps to reduce the migraine. But if it helps, then the patient can go for the surgery. Gummy smiles are also a target for Botox. But it's not only the skin I'm looking for as a dentist, I'm also looking for the perfect teeth. And as you can see, the second inside lateral is too narrow, too small. It's not a good ratio. So we have to think about this to have it to look like this. And this actually has been 2 ladies I met during a conference in Monaco about aesthetics. So they've been really well, and they have been Ukrainian. There are several types of regeneration. For example, you don't cut it all, you just make the impression. You recontour edges. You make a very limited prep, or you make a full prep. And to smile like a Hollywood star is easy if you know how to deal with the expectations of the patient. For example, I was giving not only presentations, but also I had an appearance at a local market fair in Mannheim, which is called the Maimarkt. About 350,000 people come every year, and so we presented the service, and it was quite well responded. So maybe you have a fair around here, so marketing is part of our business. Veneers are veneers you just put on top of the sound tooth. There's nothing done. For example, before and after. Which one was more painful? The first or the second one? The second. Okay, close up. And also continuing and putting some direct composite. That's plastic material you form on the tooth and then polish it and grind it. For example, little mix down up there or here some discoloration. Later on, she wanted to have the Hollywood smile, so she got it. Before and after. And this is done within 1.5 hours. So it doesn't take a long time. Another before and after. This guy was suffering from severe loss of enamel because of intense use of grapefruit juice and acidic juices, and so I could help him with some composite veneers, as you can see. So reasons to that is when teeth are not aligned, so you have to reduce this structure, and then they are very discolored, or they have this poor arch contour. Here are some examples. This lady had a missing lateral tooth, so we made out of the canine a lateral tooth, so it looks more natural and the appearance is undisturbed. Another lady, before and after. Now a lot of ladies, I know. Maybe it's not personality, I don't know. The ideal selection is something you can read yourself. If it's of interest to you. Herbal veneers are veneers which are just put on top of the enamel without doing anything, with no grinding, no polishing, nothing. You just make an acid etch technique. That means you put a phosphoric acid on top of the enamel. This makes a rough contour, and then you can glue the porcelain veneer on top of the enamel. They are delivered like this. And then that's how you look in place of the model. And this is the comparison between the traditional grinding and prep technique to the minimal invasive technique without any prep, but also improving the smile. So less steps to the right. Examples. Okay, we have here the asthma. These are the veneers on the leg. They look like contact lenses. And they have to be treated with phosphoric acid. Then they have to be, after the etching, they have to be treated with aluminum oxide, 10 minutes. Okay, then I speed up. I show more pictures. Lower part of the jaw. This is composite versus porcelain. I don't really them without any explanation. They speak for themselves. You always see the jaw on the left side and the after on the right side. I hope you see that too. And then you even have Asian patients, as you can see. That's a lawyer. Be careful with lawyers. I can tell you. But she's a nice lady. I like her a lot. You see the asymmetry, and that this was improved by gingivoplasty and then replacing the front crowns and adding tooth canine veneers. So it comes to fillers. I don't want to repeat everything. She did already say it, so you can read it by yourself. Here are the potential areas. The educators explain again. Here are some materials you can use. You probably know all of them. But some are a little bit out of style, like Versilane Sub-Q. Not used anymore. Long time ago. Like me, long time ago. We have the alloplastic and the heterogeneous materials. Side effects are possible too. You have to inform the patient up front the treatment about possible side effects. And here we had a lady who wanted to have a more volumized lip, upper lip. Sculptura are used once, but left the technique because it's permanent and no mistake is forgiven. As a dentist, you're used not to make mistakes, but I don't want to take risks anymore. After being 35 years in my office, no more risks. Hyaluronic acid, immediate visible results, no allergy testing, as you know. And it will degrade after 2 years or so. That's the maximum time which you can expect to be installed. Long-term effect lasts 6 to 12 months. I would say even longer. These are the target areas, the lower face. Depending on which kind of wrinkle you're targeting, you are choosing for the right depth of the injection. Also, you have to choose in between different viscosities. I don't want to repeat what she just said. So these are some of the examples. The snapping. We can fill up the commissure. Especially our female Chancellor Angela Merkel had such commissures. She would have profited from such a treatment, but she never went for it. Before and after, equipment. Before you start again, do your job. Ten minutes or 5 minutes? 5, okay, I'll speed up. Here we have a combination of front crowns and the crown line. And this is turning back the clock a little bit. Characteristics that can be done also with classical veneers. For example, the lady suffered from severe discolored teeth in the front. That's the end result. Or here, a male one, end result. No inside the show. Much better now. This lady. So you can see I have some experience. Some. Always done. And that's the reason I'm here. Now you come, male again. She's a veterinarian. For several studies are always important to restore a tooth like nothing would have happened. When it appears natural again. That's easy with ceramic. For example, and finally, lipolysis. To target certain areas in the face. How does it work? You can read by yourself. I have to speed up. I could tell you more. It's lipostabil. You know lipostabil? No, okay. Very, very well researched product and works well. You applicate with the Mesorol. That's the procedure. These are areas in the face. You can use chin treatment, for example. Before and after. Here. The jaw. What's the word for the double chin? The double chin. That's the word for it. Yeah, the double chin. So a combination of crowns, veneers, and lateralizes of the double chin. There we go. Before and after. These are the absolute contraindications. Relative contraindications, and we even can target belly button fat. Now, if the female patient wants to unclose in front of you, that's the prerequisite. Let's see. Bleaching is another topic. I go through really fast. So you see before and after. There are two ways to bleach. You can go for the home bleaching and the power in office bleaching. I don't want to talk about it in detail. There are walking bleach techniques when you have a root canal treated tooth and this discolors over time. You can bleach it before you crown it. Rather to save the tooth structure by changing the color than cutting down the tooth and putting a crown on top. That's my opinion. But nowadays I don't favorize root canal treatments anymore. As you know, I place ceramic implants. So I don't want to go into detail with this. Is somebody bleaching? Does somebody bleaching in the office? Nobody. this could be something you could do as a anti-aging specialist, because white teeth are making people look younger. That's the point, and it's easy. Mesotherapy I go through really quick because this is too much now for the short of the time. The actual technique is to map and to put in the dosage into the mesoderm. From consent again, then we have Invisalign. You all know that's the orthodontic treatment with appliances. Versus brackets, but when you have severe disaligned teeth like these up here, you need brackets. Okay, we have here the example. That's the after. So the diastema was closed. They come in packages like this, and every 2 weeks you exchange the appliance, and this does the job over time. Here we have another examples. Asian baby again, as you see, from China. And identities from the United States. Then we have chemical fluids. This was covered by the lady before me, so I just watched through it. Here are some examples before and after. So, success in life consists of going from one mistake to the next without losing enthusiasm. I would like to go from one success to the next without losing enthusiasm. That's my credo for the last few months I'm in my office. And are those minimal invasive techniques for you? You have to decide on yourself. I showed you a lot of examples, before and after pictures, not diagrams, but real life photos, and then you can decide for yourself. Would I go for the treatment myself? That's the most important question you have to ask yourself.
Thank you so much, Dr. Hans Albrecht.